Yeah. So I'm going to talk about choosing the right IOL. So it's between monofocal, multifocals, EDOF, and trifocals. So I do not have any financial interest in the presentation. So basically, we heard from the previous speakers how cataract surgery is evolving and changing. So these are some of the drivers of good outcomes after cataract surgery. The first and the foremost is the safety and the efficacy. And the second thing is the efficiency. Efficiency, not only the efficient surgeon, efficient machines, and all the IOLs also have to work. So all three have to go hand in hand. And no longer it is just doing the cataracts because, as Anand said, have to correct the refractive things, and also patient wants spectacle independence. So choosing the right IOL, actually it was only the surgeon's choice before. So we always used to go based on the material, which was good, hydrophobic, hydrophilic, and about the design and the different types of haptics and the cost. And then what type of procedure will suit the patient, whether he's going to do a phaco or 1.8 or 2.8. And then post-operatively, we want less inflammation, no rates of PCO and dysphotopsia, and spectacle independence. So we should always, there is a trade-off between what will ideal for the patient and what the lens can deliver. So, but nowadays we have these patients who are more demanding, and there's like a new classification that I have done, like it's more based on the social cost, like how motivated are the patients, do they understand what is a trifocal, how the EDOF is going to help them. And second thing is about the friends. If they already got something, they come and ask you that I want to see everything at all ranges. So the demands of the patients have come in front rather than us trying to choose. Then the other causes, like what type of work do they do, what type of lifestyle do they lead, and also different makers and costs. They want the imported ones or Indian manufactured ones, and also the economics. As long as India is concerned, I think economics is a very important factor. So basically they want to read, they want to be on the laptops and screen, they want to do their driving, play with their grandchildren, at the same time not have any of the glare and halos. So basically we have these four types of lenses: the monofocal, the EDOF, the multifocal, and the trifocal. So I'll just try to keep it very simple. As long as we know monofocal, they just give one range of vision, that is you have clear distance vision. And then the EDOF lenses, basically they work on positive spherical aberration. So basically what is done is that one point of focus is elongated. So patient has very good distance vision and then have good amount of intermediate vision. But then they do not have near vision. Multifocal lenses have been there for so many years, so I don't have to go through it, the diffractive technology. So basically they have 2 points of focus, that is distance and near, and the trifocal, 3 points of near. So the best way to understand this was to do a study. So we did a study in our own hospital and comparing between these four lenses. So because basically before telling the patient what and how it works, so we wanted to do a study. So basically we took a monofocal lens, and then we had a diffractive multifocal lens. So the basic thing in diffractive multifocal lens, they have lots of rings, and the step of the rings are very sharp. So that is why they have more loss of light, less contrast, and more glare and halos. So what the trifocals did is they started spacing out these rings, and then they had intermediate vision, and they had something called apodization where they rounded the edges. So the loss of light and this thing was lesser. So patient had definitely better contrast and less glare and halos as compared to the multifocals. But one simple point is when you have rings in any IOL, there is going to be some amount of glare and halos. So never say the patient that you will not have. So always keep them warned before surgery. The third thing, actually initially we did the study with the in-focus lens, but then we shifted it to the Rayner lens, the EMV lens, or the extended monovision lenses. So these are a type of EDOF lenses where it's based on the positive spherical aberration. So you don't see any rings, no bulges on the surface. So it is just like looks like a plain monofocal. So then we did the study for 1 year and we compared the results, taking into consideration all the inclusion and the exclusion criteria. So I'll just move on to the results. If you can see in the first, I don't have a point, the first graph, as far as distance vision is concerned, I think all the lenses have good distance vision. So then when you come to the third graph, for near vision, you can see that the orange line, that the multifocals and the trifocals have very good near vision, almost N6 for all patients. But then there's a slight drop when it comes to the extended depth of focus lenses, and we all know that monofocal lenses don't work for near vision. And then the fifth graph, when you see for the intermediate vision, so here what happens in trifocals and the extended depth of focal lenses, you get good amount of intermediate vision, that is basically ranging from 40 centimeters up to 80 centimeters where all your tab work happens. And then, oh sorry, thanks. Anyway,
You can use the cursor.
Yeah. So as long as the intermediate vision is concerned, you can see that the trifocal group and the extended depth of focal group works. So this gave us a broad idea about how these lenses work, and it made it easy for us and our counselors to counsel the patients depending on what is needed for them. So this is again the defocus curve that we did for all the patients. So as you can see, the blue line, the monofocal, they are very good at distance, but then there is no intermediate or near vision. It's a very simple graph that can be done and to the patient for us to self-analyze and to see how the patient sees at all distances. The second orange line, as you can see for the multifocal lenses, as I said, 2 focal point. So up to 2.5, they have good reading vision, but in between, they don't have the intermediate vision. The trifocal lenses, as you can see, there is one at 1.5 and another peak at 3. So because they have the 2 zones, so that is why they are good at this, near vision and some amount of intermediate vision. But it happens only at 2 peaks. So why that 2 peaks is, again, there is some amount of loss when it comes to one area where there is no elongated focus. They just have 2 focuses. But then last, when you see any of these extended depth of focal lenses, they have good vision, they have good amount of intermediate vision and considerable amount of near vision up to 2 to 2.5. So that is why when we do EDOF, sometimes you have to tell them, if the patient wants only reading vision, go for a multifocal or trifocal. If they need to do more range of vision, like playing something or just tab work, we always suggest them for EDOF lenses. And if they're going to be driving and very young age and active. And nowadays, what I would say is, like, monofocal lenses are slowly phasing out, and then I think that's where the EDOF lens space has come into. Like, instead of a monofocal, you're giving an added advantage to the patient. And the second thing with the EDOF lenses is for glaucoma patients, for retina patients, where all these were contraindicated for multifocals and trifocals. Now you have another lens that works for that also. So as long as the contrast sensitivity, yes, monofocals are the best. But then the second best was the extended depth of focus lenses. Any of these lenses that do not have a rinse have
Nivean,
good contrast.
Nivean,
Yes, sir, done.
please sum up.
Last slide. Yeah. So basically, yes, considering the surgeon's experience with IOL technology would be better than just going with the marketing strategies. There is no single multifocal or a EDOF lens that will suit all patients. So we should know the needs of the patients and then have a holistic approach, be patient-centric, and considering their visual goals in life. Thank you. Thank you, sir.